Then we are entering into some sort of clinical chemistry. Okay.
Okay, ma'am. Okay, ma'am.
What about your idea about glucose homeostasis?
Mm, Homeostasis is the tendency of a thing to remain constant.
Mm,
So glucose homeostasis means
mm,
tendency of
mm.
glucose in our body to remain constant. No, ma'am.
Okay. Tendency of our body to remain constant. Okay. So normal. What is the glucose level? Normal blood glucose level.
I don't know,
Normal.
ma'am.
Hmm?
I don't
You
know, ma'am.
don't. You don't know. Okay. So we must know the level of glucose because glucose is the very important factor, and we gain energy and all things from glucose. So the normal blood glucose level we can split into three stages. Okay. Hmm?
Okay, ma'am.
Just write
Okay.
down fasting
Hmm.
blood sugar. Have you heard about this? Fasting blood
Yes,
sugar.
ma'am. Yes,
Okay.
ma'am.
Any diabetic patients in your home?
No, ma'am. But I've
Relatives
heard of
and
it.
all? Okay, heard of. Okay, so fasting blood sugar.
Okay, ma'am.
Okay,
Okay, ma'am.
FBS. Okay,
Okay.
the
Okay,
normal
ma'am.
level of fasting blood sugar level that is equal to 70 to 110 milligram per dl.
Okay, ma'am.
Okay, then random blood sugar level. What is meant by fasting blood sugar level, Vishnu? What is your idea?
You
Just
have,
fasting means.
I think,
Mm,
after dinner you shouldn't eat till you give
mm.
your blood or something till next day or something. It's not.
Next day, morning. Okay,
Yeah, and then you go give
morning
your blood
sample.
and then you have to put.
Okay, that is known as fasting blood sugar level. Normal blood sugar level that is equal to 70 to 110 milligram per dl. It is present in milligram, not in grams. Okay.
Wait, ma'am, fasting blood sugar is 70
Mm.
to 110 or normal?
Yeah, that is the normal level 70 to 110, 110,
Okay. Normal level for
110
fasting blood sugar.
blood sugar level. Okay.
Okay,
If
okay.
that level exceeds, that will indicate diabetes mellitus. Okay.
Okay, ma'am.
Then
Okay.
if less than 70, that indicates hypoglycemia.
Okay,
Okay.
ma'am.
You know
Hmm.
that term hyperglycemia and hypoglycemia?
Yeah, one is less and one is
Um,
more. I know that.
okay, okay. No problem. You just understand.
Yes, ma'am.
There is blood glucose. Hmm? That glucose
Okay,
gives
ma'am.
us energy. So there is a normal level of glucose in our blood. Fasting level it is 70 to 110 milligram per dl. There should be variation in the level of glucose when we take food. Okay, after
Okay,
two
ma'am.
and a half hours after food, there will be some sort of change. Yes, in fasting
Yes, ma'am.
condition also there are some changes. There are some changes. Okay, so we
Okay,
can
ma'am.
take three blood sugar level. Okay, first one
Okay, ma'am.
is
Okay,
fasting
ma'am.
blood sugar level. Fasting blood sugar level means FBS that is equal to 70 to 110 milligram per dl. Second one is known as random blood sugar level. You can write it as RBS.
Okay, ma'am.
Hmm? Write down RBS.
Yeah, wrote.
Hmm.
No?
Hmm. Random blood sugar level.
Okay, ma'am. What is the value?
Value is equal to 80 to 120. Sometimes it is up to 140. Okay,
Okay,
80 to
ma'am.
120 milligram per dl. So, what is meant by random blood sugar level? Random. We check up random checkup. That means at any time,
Anytime we go.
any time. Okay,
Okay, okay,
okay. Food
ma'am.
is taken or any it is not morning sample or fasting sample. From morning to evening till night at any time give sample. It is known as random blood sugar level. Okay, normally we used to do this RBS. Okay, patients are always take this FBS, diabetic patients, and also some if doctor suggests FBS, then only FBS conducted. But normally we conduct RBS, random blood sugar level. Okay, then one
Okay.
more sugar level, it is known as PPBS.
PTDS.
No, no, double P, PPBS. Okay,
Oh, TTDS. Okay.
I will explain
Okay,
that
ma'am.
word. Postprandial, P, pen,
Okay.
postprandial blood sugar level.
Prandial.
Yeah, new word.
Okay.
Didn't heard till now?
No,
Hmm?
ma'am.
No.
No, ma'am.
Okay. After taking food, 2.5 hours later, we collect sample. Okay.
Okay, ma'am.
It is
Okay,
known
ma'am.
as PPBS. Okay.
Okay.
Right? It is equal to 80 to 140 milligram per dl. Okay. So we take food at 12 p.m. 12 p.m. Then we take our blood sample at 2.5 p.m. Okay,
Okay, ma'am.
that is the correct
Okay.
way. So, after the digestion and absorption of food, okay, the level of glucose will change. So, we have to monitor these three different blood sugar levels.
Okay,
Okay,
ma'am.
for the correct
And
assumption, we need FBS, RBS, and PPBS. Okay,
okay.
Vishnu.
Okay,
So
ma'am.
you just explain, we discuss what is meant by glucose homeostasis, and
Mm.
there are three blood sugar levels. Just explain. Hmm?
Uh, Basically, there are three blood sugar level. One is fasting blood sugar. One
Hmm?
is uh, one is random blood sugar, and one is post
Hmm.
prandial
Hmm.
blood sugar.
Okay. What is
And
PPBS?
the
Postprandial. Hmm.
the 2.5 hours after food, we take the
Okay.
blood.
Okay. What is the
And
normal level of fasting?
is 70 to 100 milligram
One,
per dl.
110 milligram per dl. Almost all parameters are expressed in milligram per dl except protein. Protein present in grams. Okay.
Okay.
All other biochemical parameters are expressed in milligram per dl. Okay.
Okay.
Before enter into glucose home, what is meant by glucose homeostasis? We have to
Glucose
keep that
homeostat.
normal range. Yes.
Yes, ma'am.
Okay, we must maintain that normal level. Otherwise, that will lead to two conditions. Hypoglycemia. What is meant by hypoglycemia?
Hypo is less.
Less than, less
The
than
70.
70. Hyperglycemia,
110. I
greater
mean,
than,
more than
more
110.
than 110 milligram per dl. Okay, which is the main hormone involved in the regulation of glucose level?
Hormone, glucose, insulin.
Insulin. Okay, already that is written in our slide. Okay, insulin. What is the role of
Yeah.
insulin? Hmm? Role of
Insulin
insulin.
is
Ah,
maintains the glucose level in our blood, and
how? How?
insulin is a hormone, no, ma'am.
Yes, hormone. We
I
discussed that
think it
insulin.
induces secretion of glucose.
What is your idea about the
Hey, yeah.
structure of insulin? Ah,
Uh,
ah.
Structure. It's
Mm.
a
Primary structure
ah,
of protein.
yes, peptide.
Ah,
It has peptide bond. Yes, primary
peptide
structure
bond and
and disulfide.
and disulfide linkages. Disulfide
Yes.
linkage due to the presence of which amino acid?
Uh,
Mm.
this SAM. No?
Sam. You love Sam.
Yeah.
Always Sam. Not cysteine. Methionine. That is
Ah,
for transmethylation, our first class. I
cysteine.
think you always
Cysteine.
remember that first class only.
Yeah.
Okay.
Cysteine, ma'am. Yes, ma'am. Cysteine.
Cysteine. Sulfhydryl group. SH group is there. Two cysteine. You can see the
Yes,
diagram
ma'am.
now.
Yes,
You can see the diagram? Yes. So A chain
yes, ma'am.
contains 21 amino acid, B chain contains 30 amino acid. These two chains are linked together by disulfide bond. Yes? Hmm?
Yes, ma'am.
I think
Yes,
I
ma'am.
repeat this same thing minimum 5 or 10
Yes,
times.
ma'am.
Yes.
No, ma'am. I
Yes.
remember. I remember.
Okay, okay. Then which one
Okay.
secretes insulin?
Uh, this
Ah,
is,
which cell?
uh,
Ah,
insulin. Insulin itself.
insulin is
Insulin is
secreted by
pancreas. Pancreas.
pancreas.
Pancreas.
Which there are different types of cells in pancreas. Which cells secrete this pancreas? Alpha, beta, delta. Which one?
Beta.
Beta cells of insulin. Beta cells secrete insulin. Langerhans of pancreas. Okay. So at first, you just understand. At first, this insulin secreted as pre-pro insulin. Okay. Hmm?
Ma'am, what? The insulin is secreted as?
First form of insulin. Okay. At the time of
Yes.
synthesis, it is secreted as pre-pro insulin. Okay.
Pre-pro.
Yes, that insulin contains
Okay,
109 amino acid. Okay, you no need to
okay,
study it all. You just understand. Okay, pre-pro insulin that contain 109 amino acid. Then it is converted to pro insulin that contain 86 amino acid. Then again it is cleaved by protease and a small amount of peptide. It is known as C peptide or connecting peptide is removed. Okay, then
okay,
finally our insulin with 51 amino acids are formed. You got the point?
okay.
Okay,
Yes, ma'am.
just understand. So many amino acids are there in the first form, A form. You can see the picture. Yes,
No, ma'am. I can see biosynthesis of insulin.
biosynthesis not.
Yeah, it came. Now it
Okay,
came, ma'am.
okay, okay. You can see any disturbance.
No,
Mm?
ma'am. It's some other room, I think.
Okay, okay. So, first type A form it is known as pre-pro insulin. The second form, it is known as pro insulin. You can see the
Okay, ma'am.
peptides are cut and the length is shortened. Clear?
Yes, ma'am.
Okay, where are you going?
I studied this.
Okay, okay, okay. You
Yeah,
studied
yeah, I
this?
studied this in 12th or 11th or something, no?
Okay, okay. So pro insulin, and finally
The middle
insulin.
is cut and then they are joined
Yes, the
together.
middle form is known as
Oh, yeah,
C
yeah, yeah.
peptide, the pink color that is known as C peptide or
Yes,
connecting
sheep.
peptide. Okay, yes,
Okay, okay.
okay.
Yes,
Then,
ma'am.
which are the factors that increasing insulin secretion? Okay,
Okay, ma'am.
there are two
Okay.
factors. It is known as glucose. Glucose, of course. Hmm? When blood glucose level increases, what happens? Insulin
The
secretion
insulin secretion increases.
also increases. Beta cells
Yes.
have GLUT2 receptors that act as sensors of blood sugar level. Okay,
Okay,
okay.
ma'am.
Then there
Okay,
are
ma'am.
some hormones, gastrointestinal
GluT2
hormones.
receptor.
Yes, GLUT2 receptors. That receptors bind with glucose. Okay, they act as the
Okay, ma'am. Okay.
sensors of blood sugar level. Okay.
Okay, ma'am.
Then second factor that is gastrointestinal hormones. Okay.
Okay, ma'am.
Okay.
Okay.
So blood glucose level regulation starts from digestion and absorption, right?
Yes, ma'am.
Yes. So
Yes, ma'am.
gastrointestinal hormone have a special role. Okay.
Okay, ma'am.
So secreting pancreozymin and gastrin. After taking food, these hormones increased. Okay. Okay,
Okay, ma'am.
Vishnu.
So
Okay.
these three
These
hormones are increased after food.
after food, and that will enhance the activity of insulin.
Okay.
Okay. Hmm?
Okay. Okay, ma'am.
Yes. Okay. Then mechanism of action or physiological action or metabolic effects of insulin. Okay.
Hmm.
Hmm?
Hmm.
So
Yes, ma'am.
insulin receptors are there. Insulin, it's an hormone. So I told you hormones always act with the presence of receptor. Yes. Yes, Vishnu.
Ma'am, it's hormones always act with the presence of
Of receptor.
receptor. Okay, ma'am. It
At
was
the time
breaking.
of
That's why.
at the time of vitamin D, we discuss it.
Yes,
Hmm?
ma'am. Yes, ma'am. Yes, ma'am.
Vitamin D act as a hormone. Yes, you
Yes,
remember?
ma'am. Yes,
Okay.
ma'am.
Okay. So insulin is a hormone. It acts by binding with plasma membrane receptor on the target cell. Okay.
Okay, ma'am. Okay.
In the case of obesity, what happens? The number of receptors are decreased. Hmm?
Okay,
You
ma'am.
got the point? Got the
So
point?
basically, they're telling obese people have more chance of getting diabetic.
Yes, that's all.
Okay.
Okay, obesity, what is the reason? We know obese persons are very sensitive and they can get diabetes mellitus type 2. So what is the hidden reason behind it? In obesity, number of receptors are decreased and target tissue become less sensitive to insulin. That is the reason. Okay,
Okay, ma'am.
okay, Vishnu.
Okay, ma'am.
Then uptake
Okay.
of glucose by tissue. Now we discuss the action of insulin. So facilitated diffusion of glucose in muscle, it is enhanced by insulin. But in case of diabetes mellitus, the particular receptor GLUT4 is reduced. Carrier protein is reduced. Okay.
Repeat that one more time, ma'am.
What?
One more time, can you repeat that, ma'am?
Okay. Uptake of glucose by tissue. How does glucose uptake occurs in tissue with the help of insulin? That's all. Okay.
That's it.
So
Okay.
facilitated
What is this
diffusion of
GLUT4?
GLUT4, GLUT2, like that transporter of glucose.
Okay.
We can
Okay.
consider them as receptors. Okay. Transporter or receptor. Okay.
Okay.
Clear. So the presence of GLUT4 is reduced in case of diabetes mellitus.
Okay, ma'am.
So glucose utilization increases or decreases in diabetes? What happens?
Decreases, right?
Decreases. Why? Why?
Because the
Special
uptake of
protein.
glucose. Oh,
Yeah. You are entering into that point. Explain, Vishnu.
uptake of glucose by tissues require this enzyme, no, ma'am.
GLUT4, not enzyme. It's a protein.
Okay.
GLUT4.
GLUT4.
Okay.
GLUT4. Yes, ma'am.
Mm.
So when it's reduced, diabetes
When it is
occurs.
reduced, glucose uptake cannot occur. Okay.
Yeah,
So
that says
glucose
yes,
utilization decreases. Okay. So which
yes,
one
ma'am.
enhances this utilization? And insulin.
Insulin.
Okay.
Yes, ma'am.
What happens in diabetes mellitus? There is no insulin.
Okay, ma'am.
Yes.
Yes, ma'am.
Insulin or insulin receptors are deficient in diabetes mellitus. Okay.
Okay, ma'am. Okay, ma'am.
Okay. Next, what is your idea about metabolism? Carbohydrate metabolism.
Yeah, that.
You loved
No,
it
ma'am.
or you
So
don't know?
this
Hmm?
I love metabolism, ma'am. But my point
Hmm.
is, ma'am, that people with diabetic people, right, ma'am?
Hmm. Hmm.
First of all, what is diabetic type 1, type 2? Four are there, no, ma'am? Four types are there, no?
Four types are there. Yes,
Yeah.
diabetic prawn states are there. Okay, then
Yes, ma'am. What is the difference
Modi is
between all?
there. Maturity onset diabetes mellitus is there. So diabetes is a huge topic. Okay, when we enter into, I
I have
have to
seen people
explain
to take
all
that
this.
injection.
Yes,
I have seen
diabetes
people take
mellitus.
that injection, no, ma'am.
Yes, what I will give you some points. Diabetes
Yes.
mellitus type 1, it's a genetic disorder.
Okay, ma'am.
Okay, so in case of type 2, it starts up after 30. Okay.
Okay, that's also genetic or that is due to conditions, lifestyle.
Acquired lifestyle disorder, but diabetes mellitus type 1 is genetic disorder.
Okay, ma'am.
Okay, so if it is genetic, it starts from newborn baby
Both.
by birth.
Okay, ma'am.
Okay,
Okay,
and
ma'am.
they start
Okay.
their insulin injection. It is very pathetic condition. Yes.
From baby, they have to take insulin. Okay.
Oh, lifelong insulin that will create so many issues. So many issues. Okay,
Yeah,
it's very
I've seen.
difficult to handle. Okay,
I've
but
seen people can't eat
yeah,
carbohydrates, no? They can't eat
yeah,
anything with the glucose without taking
yeah,
insulin shots.
yeah. It's same.
And
If we take an extra amount of insulin, what happens? Hypoglycemia will be there. Okay.
mm,
So it's very dangerous. Which type, which the amount of insulin is very important. Repeated blood sugar estimation is needed. Regular checkup is essential. Okay.
and type
Uh,
3 and type 4.
Type 3 diabetic prawn states are there. For example, have you heard about GDM, gestational diabetes mellitus? At the time of
Mm,
pregnancy, people have diabetes. Okay. Hmm?
mm,
You can ask your mother. Yeah, in all time of pregnant, in the case of at the time of pregnancy, what happens is that uh, there is a regular checkup and glucose is estimation conducted. If there is any type of genetic history, maybe
okay.
father diabetic or mother diabetic, okay, they will
Mm,
write in the chart itself. Father is diabetic, mother is diabetic. Okay, then one special test is there, glucose tolerance test. Have you heard about it? In
yeah,
your
ma'am.
questions from your ma'am,
Yes, ma'am.
glucose tolerance test is there.
Yes, ma'am.
Okay, if there is sometimes at the time of pregnancy, the mother is diabetic, and after pregnancy, back to the normal. Okay, there will be no problem. But at the time of pregnancy, if mother is diabetic, the baby will be a big baby. Big
Okay, that
baby means what is the normal body weight of a newborn baby?
3 kgs, no? 3.5 or something.
2.5, 2.5 to 3,
2%.
3.5 is okay. But in case of diabetic mother, they have 4, 4.5.
But there's no other problem, no, ma'am. Only small like this, no?
Big baby and also premature death. So many
Of the baby.
complications are there. Yes, then prematurity occurs 7 months, 8 months. So many problems are there. But till it is almost controlled. Okay. In olden days, it's very complicated. But now it is almost controlled. Gynecology department is very much advanced and all. So no problem with that. But big baby is a small issue because protein metabolism increases. Okay. Carbohydrate utilization decreases. That's why protein metabolism increases and protein anabolism increases. The baby growth occurs. Okay. Okay.
And type 4,
This
ma'am?
type 4 is related with some other disease. For example, cancer. Okay. Along with cancer, there is a chance. Still now, there is no diabetes. When this cancer identified starts, the next one is diabetic. Okay. Okay.
So
Till now,
other than this, there's no difference between all this type 1. Like in cancer, there are 4 stages, no, ma'am. And fourth stage is very severe. Right?
Yes, you just understand. Diabetic prone states are there. Okay. That is our third category. Which one is type 1? Type 1 diabetes mellitus is genetic disorder.
Genetic.
Type 2?
Yes.
Yes. Type 2 is
Type 2 is
lifestyle.
acquired.
Yes. Then third one is known as diabetic prone state at the time of pregnancy and all. Then fourth one is also diabetic prone state. We can call it as diabetic prone state when severe diseases occurs. Okay. Diabetes is a huge chapter. We can discuss 3, 4, 5 hours with diabetes. Then it can affect different areas in our body. Which are the different areas? I will give you some short notes about diabetes. Okay.
Which are the different areas?
Which are the different areas? Any idea?
The diabetic and diabetic patient, maybe heart.
Diabetes is the mother of cardiovascular disease. Okay. There is a huge chance for blocks and all. Okay, there is a chance for myocardial infarction and all. First one. Okay, diabetes can affect heart. Then second one, it can affect eyes. Diabetic retinopathy is there. Diabetic neuropathy is there. Diabetic nephropathy is there. Okay, it's a rhyming word. Neuropathy, nephropathy. We can call it as very
simple. And this can't be cured, no, ma'am?
We can control diabetes.
By taking shots, but you can't cure it.
Yeah, we can't cure
even acquired one, ma'am.
Acquired
even
one.
the acquired one.
Yes. Even
that
the
also
acquired
you can't cure.
Nowadays, diabetes is the most marketing disease. One of the most important marketing factor in laboratories and all, medicines, insulin and all. The leading disease which control our medicine, our pharmacology, biochemistry, all area. Labs changes the value. Okay. Now
so if you get diabetes, then forever you have to take shots. That's it. No, nothing else you can do, right?
Yes. No way. Control. Before entering into medicine, if it is type 2, before entering into medicine, you can strictly concentrate in your diet. Okay. Then you can try to return to the normal level. Maybe junk food maniac. They can reduce. Okay. Short-term intervals, you can take your food. Add more dietary fibers into your food. Protein-rich food. Okay, avoid fried items and all. Then we can control minimum 2 weeks. Then this type of lifestyles can change our blood glucose level. When it is first identified, I told, when it is first identified, before enter into medicine, strictly follow one diet plan. You can try. But if the level is greater than 150 milligram per DL, Fasting blood sugar level. Which is fasting blood sugar level?
70 to 110.
70 to 110 milligram per dl.
110.
Yes, 110. I always told us 110. That's fine. Okay. Then, so greater than 150 milligram per dl, no way. Okay. That person is diabetic. We have to take medicine. Otherwise, so many complications are there. Full time weakness. Okay.
Yeah, ma'am. I have seen one person fainting and all.
Yeah, fainting.
And they give
must,
chocolate immediately, right?
yeah. They must have take food between 2 hours interval. Okay. Glucose
Okay, ma'am.
utilization is very poor. Okay. It's a very
Mhm.
difficult situation to handle and all. This
Okay.
diabetes is very difficult situation. Try to manage that disease. Try to manage. If it occurs, don't worry. Try to manage. You can advise him. Don't worry. Keep a healthy diet style, and always take food between 2 hours interval. Take more water.
Yeah, I
and
don't
all.
know this person personally, ma'am. I saw a person fainting and another person running and giving chocolate. That time I
Okay.
understood.
That is diabetes. Okay. Okay. So many
Because
students are there
yes,
in my college. They have diabetes from their very young age and start their insulin injections and all. I know. It's very difficult situation to handle it. Okay. Our topic
okay.
is mislead and I'm entering into diabetes. It's a
No,
huge chapter.
I just wanted to know about it.
Okay.
Like,
Very good.
yes, ma'am.
I'm interested in to share anything about my biochemistry. I'm interested. Okay. Okay.
Yeah.
Okay. Then utilization of
Oh,
glucose. Okay.
oh, yes, ma'am.
Okay. Our topic is utilization of glucose. How this glucose utilized? They can enter into different pathways. I think you told me you love metabolism. So what is
Yes, ma'am.
glycolysis? What is glycogenesis and what is fatty acid synthesis? Hmm? Hmm.
Gluco. What the question, ma'am?
How this after digestion and absorption glucose enter into body. Okay, now glucose are in tissues. What happens
Yes,
to that
ma'am.
glucose? How it is utilized? Hmm?
Uh,
Yeah.
I think it's no carbohydrate is converted into glucose and stored in a body.
Hmm.
Then
Hmm.
after that what happens? After that it enters this tissue,
Hmm.
right?
Tissue. Now it is in tissue. What happens next? How the energy
Then I
formed
think it's
from
broken down.
broken down. Everything is broken down. That from that glucose converted into what is glycolysis?
Uh,
What is glycolysis? Hmm.
Glycolysis is the
Hmm.
procedure, no, ma'am?
Procedure or
Huh?
metabolic pathway. Okay. Okay.
That
Anyway,
glycolysis is uh, I think no
glucose.
glycolysis is connected with carbohydrate metabolism, right?
Mm,
Oh yeah. Uh,
mm,
it
yeah.
gets glucose gets
I will give you the
converted into
explanation.
something.
Okay.
Yes,
Glucose
ma'am.
is in aerobic glycolysis and anaerobic glycolysis is there. In case of aerobic glycolysis, glucose can be converted to pyruvate. Hmm? Then in
Yeah, two
anaerobic
pyruvate,
condition, condition, glucose
lactic
converted
acid.
to lactate. Yeah, you know
Yeah. And,
everything, but you don't know the
uh,
basic thing. Hmm?
muscle cramp and all. I remember, ma'am.
That is lactic acidosis. It's a
Yes,
different
yes,
topic.
ma'am.
Okay.
No,
So,
when people run and
uh,
out of oxygen and all,
yeah.
they get
So lactic
muscle
acid
cramp and all because
accumulation,
yeah.
lactic acid
Yes.
accumulation occurs. You know everything, but there are some missing points. You just connecting peptide is there. So you just connect all those points together. Okay. Hmm?
Yes.
So glycolysis, the formation of energy from glucose. Glucose can be converted to pyruvate in aerobic condition and glucose can be converted to lactate in anaerobic condition. Okay. Then what is meant by glycogenesis?
For Genesis, I think
Genesis
what is
means
it?
synthesis. Synthesis. Glycogen synthesis. It is known as
Yeah,
glycogenesis.
Process of synthesis of glycogen, yes, ma'am.
Yes. So how does glucose, if excess amount of glucose is there, what happens to glucose is that glucose converted to
It
glycogen.
converted to glycogen. Yes, ma'am.
Yes.
Through this process, no, glycogen
Yes.
is there.
Okay.
Yes,
You remember everything you remember, but connection problem. Okay. Then fatty acid synthesis.
remember
Okay.
suddenly.
Fatty acid synthesis is the third point. Okay. That's about the utilization of glucose. Then next is hypoglycemic effect. What is the hypoglycemic effect of insulin? Insulin lowers blood glucose level. Gluconeogenesis is inhibited. What is this gluconeogenesis?
Gluconeogenesis, I don't know, ma'am.
Actually,
This thing, no, reverse process, no, something like that, no,
mm, tell
reverse, no, ma'am, reverse or something, no,
definition of gluconeogenesis.
reverse of one process.
Glycolysis.
I think yeah,
Reverse,
reverse.
some steps are reversal of glycolysis in case of gluconeogenesis. Okay,
Yes,
so
yes, ma'am.
actually by definition, we can synthesize glucose from non-carbohydrate substances.
Okay, ma'am.
Okay, so in case of hypoglycemic effect, gluconeogenesis is inhibited. Yes or no?
Okay,
Then
yes,
it
ma'am.
also inhibits glycogenolysis. So what is that metabolism? Glycogenolysis.
Glycogenolysis.
Define glycogenolysis.
Breakdown, no,
Breakdown of, very good, breakdown of glycogen.
glycogen,
Okay,
glycogen.
glycogen
Yes.
into
Uh, into
glycogen
what?
converted into
Uh,
glucose.
yeah, glucose, yes, ma'am, glucose.
Sorry, glycogen converted into glucose in case of glycogenolysis, and glycogenesis, what happens? Glucose converted into glycogen.